So my name is Dr. Anju Menon. I have been in emergency medicine since the last 14 years. I've trained in India, and the day after I passed out my medical degree, I joined as a senior house officer in India in emergency medicine. And since that day, I've been really passionate about emergency medicine and learning every day, which is, I think, one of the most exciting parts about being in the job. In India, I definitely had the chance to see a very number of cases, both in urban as well as rural parts of India. In fact, there is a very popular place called Tirupati, which has over 5,000 people visiting that temple every day, and I was the only doctor in charge at the time in that area for critically ill patients. So seeing patients with significant respiratory distress, cardiac arrest, and manage them, and had to shift them over to a closest hospital nearby. So and then I've had 7 years of training in UK after I finished my MChem and came here. I definitely think that one of the best parts of opportunities that I've had after coming to UK is the vast amount of knowledge that I've gained, not just in the skill aspect, the technical aspects of emergency medicine, but also the non-technical aspects like leadership and management, which I think has made me who I am today. I have passed my fellowship in Royal College of Emergency Medicine, and I'm very pleased to say that I've been awarded the gold medal for the highest scoring candidate in East Midlands, and it was called the Dr. Manjeet Riyat Award. Of course, it's very personal to me because he was my first supervisor as a trainee, and he is like a father figure to me, and we lost him unfortunately during the period of COVID. And during my training period, I also took a special interest in pediatric emergency medicine. So after my ST4 year, I had the opportunity to do my PEM year at the Queen's Medical Centre, which is one of the largest major trauma centres in Europe. And I also, on the side-by-side, in my own time, did my master's in pediatric emergency medicine from the University of Edinburgh, which was a real eye-opener in terms of critically appraising work and doing my thesis project. I did my thesis project on our knowledge, attitude and practice in managing complex needs of children, and it was a qualitative survey distributed over various levels of staff in an emergency department working in pediatrics. To talk about my managerial experience, I think what is of course, as part of my daily work, I now address complaints. But when I have worked, in fact, at your trust, I was part of a investigation for a serious incident, and it was about a patient who had a respiratory arrest in a CT, whilst the patient was in transfer for a CT head. What we did was we evaluated it, did a root cause analysis, and then came up with quite significant changes without any blame culture. So we started having transfer bags. Since then, we started having a transfer checklist, and I also focused my attention on delivering some teaching on a sim-based environment. So I think trainees and registrars found it quite useful in the hospital. I have quite a varied experience and very interesting experience with QI as well. I joined the QI projects of Royal College Emergency Medicine initially, and then went on to do my own quip and lead my own quip with Parkinson medication and administration, the timeliness of it in Derby, and initially where we weren't able to achieve even 10% of people actually getting the time critical medication on time. By the end of the project, we had over 90% of patients getting their medications on time every time. And I'm pleased to say that this project has been quite sustainable and was awarded the Best QI project in Derby, and also was selected, shortlisted for the Clinical Excellence Award from Parkinson's UK. Currently, I am the Deputy Chair for Royal College of Emergency Medicine for the TCM project, which we are carrying on since the last 2 years. I take great interest in teaching because I think that is the best way to learn. I am the instructor for multiple life support courses like ALS, EPALT and ATLS. I have been teaching on ATLS for over 10 years and now also instruct on the teachers training program for ATLS, and it gives me great pride to be part of such life support courses. I also instruct on the regional ultrasound course, and one of the things I've always found as a trainee was that if there are vacuums in the training element where we don't see that many cases but it's still part of our curriculum, I try and see how we can help with that. And so I've helped create a course called the Maternal Emergencies in the Emergency Department, which has been running successfully regionally and nationally, and I'm very pleased to say that it has also trained over hundreds of trainees across the region, giving live simulation based training. I'm also the creator and first conference lead for a National Emergency Pediatric Trauma Conference called Neptune, which was conducted in 23, and it gave me a very good idea about the business aspects as well, not just the clinical aspects of medicine, but how to deal with and how to manage the business aspect of creating a conference, managing a conference, and taking it to the other side. In fact, we had the blessing of working with great faculty like Ian McConkey, Chris Moran, Becky Platt, and the PEM Adventures, all great stuff coming out from that whole program. Was greatly appreciated by over 300 to 400 delegates, and it's in fact made monetary benefit as well. So I think there's a wide range of experience that I have from both clinical, managerial and academic perspective, and I'm really pleased to be here. I'm very keen to join your institute because I think I'll be quite valuable, and I want to be where I think I will enjoy working on an everyday basis. Thank you.